Ladies and gentlemen, the past few years, there's a statement we've heard a lot, perhaps even sometimes too often, namely Winston Churchill's observation that you should never waste a good crisis. And certainly the pharmaceuticals industry did not waste the crisis of the pandemic. It moved at warp speed to develop not only vaccines, but tests and antivirals. Our next spotlight speaker represents one of the companies that was involved in that effort. And she says that not only a crisis like COVID, but also the climate crisis can act as a major driver of innovation. Let's hear more now from Teresa Rodó. She is Executive Vice President and Head of Global Healthcare Operations at Merck. She also sits on its Healthcare Executive Committee and oversees the manufacturing, supply, and quality of Merck's biotech and pharma medicines and medical devices. Welcome, Teresa. The floor is yours.
Fine, I'm going to stay over here just so you don't only see my head, okay? First of all, I'm delighted to be here. Thanks for the invitation. As Beatrice was saying, it's such a powerful audience that I'm really delighted to be here today to share some of our perspectives around climate change. And I assume this is what will make the magic happen. Yeah, climate change. When we hear these two words together, this normally triggers in most of us negative emotions. We feel fear, we may feel distress, and at times even guilt, right? And this is absolutely natural, just simply because we're human. But there is a risk in there. When confronted with bad news, we people tend to either dismiss it outright, or believe that the catastrophe is inevitable. Either way, this may lead us to tune out and give up. Now, allow me a little comment. Ever since I was a child, like probably many of you, I have known that I have the ability to influence or at times even to change things. Obviously, at that very young age, my biggest interest was to change my parents' opinion on something that they would disagree on with me. For instance, I was thinking last night, and I remember they disagreed with me. They didn't allow me to learn German just out of fear that I wouldn't be able to get at the same time a proper command of English. And I decided, that's the earliest I think I remember, that I decided to do something about it. This is a long story that I can share in a break, but I think you'll agree with me. I'm pretty satisfied with my command of English. And I'm proudly standing in front of you today after 38 years of being in command of the German language, right? So we know that we have the ability to change things or to solve challenges or to contribute to solve challenges. And the addition of the many, many things that we individually do on a daily basis can make an amazing difference over time. Let's never forget that. So, when I hear climate change, I always try to switch that into climate action. And like any other disruptive force, the very evident climate change can, and as it was well said before, in my opinion, should, trigger us, drive us to think differently, to find new solutions. In other words, to innovate. And today, I'm going to share with you 3 examples. This is not going to be long before the lunch break, don't worry. 3 examples out of my professional life that will illustrate how climate change can stimulate innovation. From where I'm sitting, where is that? You see, I'm working at Merck, as it was announced before, And it's a very impressive company. I don't know if you know, but it was founded 355 years ago as a pharmacy. And you see it depicted here, this little picture on this side. And it was nicely called the Engelsapotheke, yeah, the angel pharmacy. And why did I say it was an impressive company? To me, it's pretty impressive that that initial pharmacy and company has been able to reinvent itself across the last centuries to become what it is today, a leading science and technology company, which is for us very important for innovation. And employing people, almost over 64,000 people globally across 3 different business sectors. So from a pharmacy, nice old building, to a business on electronics, life science, and healthcare, which is where I am sitting. And you described it very nicely. I'm heading global healthcare operations, which is a team of around 7,000 people worldwide, responsible for product development, manufacturing, quality, and supply. Very tough in the last 3 years, indeed. And with 19 manufacturing sites, with teams in over 60 countries and 160 nationalities, I was so glad to hear the previous presentation. Global healthcare operations is a very diverse workforce, a lot of power, a lot of brain, a lot of innovation of different perspectives, united by one and the same goal: serving patients as best we can, no matter what the external context tells us. And one thing I haven't told you about Merck is that until today, we're still a family-owned company, and I consider it to be a very nice characteristic of family-owned companies that we think in generations. We are in the 13th family generation, and the family, believe me, they want this business to go on for the legacy generations that will come next. Therefore, we're blessed by really having sustainability written in capital letters and being one of the 4 key priorities of Merck's overall strategy. So now, the large organization, all the brain power, the different perspectives, the different parts of technologies that we're leading are a great opportunity for me as a leader to really channel all that energy and really drive change for good. And I want to share with this very selected audience, just to inspire also the thinking, and as we heard from Beatrice, to join forces on whatever venue we can. Because as an industry, we can do as much as we can in the current framework. I was delighted to hear in the panel before that there is good new technologies to come, etc. But today we need to start making a difference. Yeah? So the 3 examples I'm going to share with you are illustrative of the end-to-end approach that we're taking across our entire value chain, and are only illustrative. I cannot depict everything we're doing, but when it comes down to tackling the reduction of our ecological footprint, and examples I have selected are very much hinting at avoiding or reducing the greenhouse gas emissions, yeah? Beyond everything we're doing for social or economical sustainability. So let's start with the first example. That I will talk about what we're doing at the product level, one for the logistics level, bear with me, and one at the patient level. So at the product level, I want to share the introduction of new and more sustainable presentations for the patient, or packages, as you can go to the pharmacy and buy something. So you see some of our medicines are coming in form of an injector pen. Probably you know some of them. And this has been like that for years, decades. And at a certain point in time, a few years ago, we realized, like probably many other companies in different sectors, the box that we were presenting that to the patients was pretty large, meaning that we actually were storing and shipping a lot of air, right? And it's not a joke. There were certainly very good reasons for that in the past. It is not easy in registered products really to make changes, but we decided to set ourselves something that was not demanded by anyone, but really to reconsider that because it didn't make sense from an ecological nor from an economical perspective. And so we came up, and you see it depicted here with a pack That's 40% smaller, but what's more important, it's 100% plastic-free. And as you know, plastic is one of the main drivers of the greenhouse gas emissions, and that's why I wanted to share this example with you. You see what this translated into, so the reduction of 33% of the CO2 emissions related to the logistics of these products. By the way, we're not done, we continue. These are 2021 audited data. And with the elimination, and that's the important elimination, of 180 tons of plastic yearly. And obviously the use of less materials, we need less volume, we need to ship in or less space by shipping, etc. And in the end, it's also less cost. But what's more important for us is that this is an enhancement for the patient convenience, because now when they have to store it at home in their fridges, the pack really can take a reasonable space and not be that unhandy, yeah? And probably this resonates with you. How many of us are ordering things at home that may be kind of tiny earphones, and when you get the pack, it's a pack, right? So let's go to the logistics level, and I will ask the panelists of before to bear with me, because that's what we can do while we are in the current context. In 2018, we were shipping 65% of our medicines by air because we want to be just in time at the patient's need, and we have patients in oncology, in other types of therapeutic areas, and we always want to make sure that they have their goods available. But we wanted to also take advantage of, let's say, the sea freight more and avoid the currently still very intense CO2 emissions air freight, and wanted to change that against many, many, many internal voices. We had our sales force telling us, you do that, our patients won't get the drugs at the time they need it. Our financial partners were telling us, oh, if you do that, our inventories will go to the roof. You cannot do that. So despite all that, we set out, and you see the 2 years I'm visualizing are very far apart, because we wanted to do so in a managed and controlled manner, and we succeeded in doing so. As you see, in 2021, we were shipping 80% by sea. If we really get to the hydrogen, etc., we may rethink, because that's not the end of the story. What's more important, if you compare both years, the emissions that we also have audited with KPMG in 2021, the reduction versus both years is 10,600 metric tons of CO2. And this looks very easy on paper, but we only can ship through validated routes, and a lot of work that needs to go behind that. And we needed to also readjust the scheduling and the production in all the lines that we have, not only in production, also in packaging, in our distribution centers, etc. So it took 2 years. This is also not done, because we continue trying to maximize the right use of the right channel, and we're also looking at other things like the last mile and these things. But this is the example I wanted to share. Now, even if it's still at the pilot level, I wanted to share 2 examples of what we're doing in terms of the patient involvement also, and being part of that journey and helping us really do the right things with the materials that we're putting in the field, yeah? And this is at the pilot stage, but it's what we can do before we can further eliminate all the plastic from our materials. And as I mentioned, I mean, our active compounds, we need to preserve at all times the integrity of the product. They may be sensitive to humidity, to light, or some compounds may interact with the primary packaging at the contact, right? So we need to make studies, which we are doing, but all in all, this is all regulated, and we need to really make go through a longer process for that, out of which we could improve a lot during the discussions with authorities during the crisis of COVID-19. So we have a pilot in Denmark designed to give patients the opportunity to recirculate used injection pens. to really tackle the challenge of recycling injection pen devices. You may not know it. What looks really very simple has hundreds of different components of different materials. And we have another pilot here in Germany designed to give patients the ability to return empty medical plastic blisters. So those of you who are living in Germany, ask your pharmacist. That really will help us. So, but now let me get to what my key message is. All these examples, they look very easy on paper. But they all are powered by science and technology in the different fields I have depicted. But they all require the human factor as the essential factor for us to turn ideas and think that any of our 7,000 employees across global healthcare operations proposes to really convert that into a value-adding solution, meaning into an innovation in the field. And I don't think we can highlight that. Each and every one of these examples and anything that you are doing at your end to really succeed in finding new solutions requires thousands of little and some big things or items that need to be tackled, decisions that need to be taken against, as I said before in the logistics example, against many important heavy voices even in your organizations. And as mentioned at the beginning of my talk, when bombarded with threatening information, we very easily may fall into fatalism, believing there is nothing I can do, or the problem is too big or too unmovable to solve. My experience in these and other examples has proven, and this is a leadership conference, so I wanted to really leave you with that message, that we as leaders have a crucial role to play to avoid this. By channeling people's energy, everyone wants to solve or contribute to solve climate change. So we are crucial to channel that, to directing people's attention and action to really what they can control. Displaying ourselves also a can-do attitude and empowering, truly empowering our teams, giving them the space to shape solutions, to try them out, to make proposals, and then really channel and if you need to prioritize like we have, really taking the right steps to make things happen. But ultimately, instilling pride in taking action and contributing to be part of the solution. And I can tell you, for me as a leader, there is nothing more rewarding than seeing the magic that contributing to, I would say slow down, not change, right? Slow down or contribute to slowing down climate change has on people. And allow me to leave you not with this statement, but with one question that to me would be very important to exchange in the breaks. What will be your climate action? Thank you.